And I realized I may be the only one who can tell this truth to the world, but I really cannot tell it in Hong Kong. Once I stand out, I will get disappeared. You know nothing.
Over 18 million people have contracted coronavirus. The global economy is facing the worst crisis since the Great Depression. And statistics say 700,000 people have died. But was all of this preventable? Dr. Li Mengyan says in December 2019, she was told by her supervisor at the Hong Kong School of Public Health to investigate the mysterious virus that had emerged in Wuhan, China. So what did she uncover? And what was the cost of speaking out? This is American Thought Leaders, and I'm Yanya Kellick. Dr. Li Mengyan, such a pleasure to have you on American Thought Leaders.
Thank you, Mr. Yang. Thank you for the invitation.
Well, I feel very honored, actually, to be able to talk to you today. You came out of Hong Kong with an incredible story to tell. A little while ago, we know some of it. Some of it has been all over the U.S. And the television and so forth. We're going to do a bit of a deeper dive today.
Sure.
But before we do that, I want to find out from you. You know, the national security law just recently passed in Hong Kong, and I'm sure you've been thinking about that.
Of course. Actually, basically, because I've been in mainland China for almost 30 years, that national security law actually is just apply what they have done in mainland China to Hong Kong and to the other countries related to CCP's control. So simply you can understand it like this. What it can be done is already have done in China.
So with this national security law, because you were working at the university in Hong Kong, right?
Yes.
At the lab in Hong Kong.
Yeah.
Would that have changed anything in terms of what you were able to do?
Actually, Hong Kong was a free-speaking country. You can tell the things, you can check the things, have your own opinion. But since a Chinese Communist Party bring Hong Kong back from UK, and after 20 years, they're hardworking. So Hong Kong become a less and less freedom place, especially since the last year, the Hong Kong movement. What we know, if you try to question the government, you try to question something very unfair, very injustice have been done by the Hong Kong government, CCP government, you will get punished or even get disappeared. It's like all happened to the other Hong Kong protesters, even without the name left, and your family will get threatened and no one dare to say this person existed. So that's the things now become worse because they use the law to show to the world that how powerful they are. And even you, I'm sure now if you take the Cathay Pacific airline and then you will be sent to somewhere and they want to question you because now you are doing something they don't like.
Right, there's that article in the national security law that says even people that aren't in Hong Kong and aren't necessarily Chinese, they also are under its very ambiguous rules.
Yes, exactly. So basically, if you tell something cannot pass their censorship, and you are in trouble.
Yeah. So of course, we've mentioned this in a number of interviews before. Listen, tell me a little bit about your career. So and like where you came from. I want to give a chance for our audience to kind of learn about you as a person. You said you've lived in the mainland China for 30 years, very different from working, of course, in Hong Kong. But tell me a little bit how you got to your role, and maybe actually why don't we start by what was your position when you left?
Okay, when I left the University of Hong Kong School of Public Health, I was a postdoc fellow there. So I have finished my medical study and obtained my MD degree in China and then moved to another university in Guangzhou to get my PhD in ophthalmology. And I was supposed to be the ophthalmology, a surgeon in China, but I want to pursue further research. So I moved to Hong Kong and changed my career to the School of Public Health, working on the virology, immunology, and vaccine development. And I've been in the WHO reference lab for 5 years, and I independently conduct the universal influenza vaccine project, and later after COVID-19 outbreak, except for my secret investigation representative of WHO, I also work on some other research related to clinical study and also the lab study about COVID-19.
So, okay, this is interesting. So you were mostly focused on influenza at the beginning?
Yes, because my lab is a WHO influenza H5 reference lab, but we are also the K-state emergency disease lab for China government. And also we conduct the surveillance for the zoonotic virus all over the world, like the SARS. At that time, my lab was the top lab who do this study, and now still the top coronavirus lab in the world. It is the top coronavirologists like Professor Madik Paris, Professor Guan Yi, Professor Liu Peng, and even Dr. K.Y. Yuan also work for the University of Hong Kong. So these are all the group of people who study coronavirus since back to 2003 and later moved to MERS. And this is the second type of the coronavirus we know who gave people some kind of bad effect and affect our global health. And later we moved to the COVID-19. So since COVID-19 come out, we also need to conduct this kind of research. And as a WHO reference lab, they need to report what they know about the global health surveillance things to WHO and to the world. That's why Professor Liu Peng at the early beginning asked me to do the secret investigation representative of WHO reference lab to my network back to mainland China because lack of information from China government.
Okay, so you're basically saying that your boss, right? I just want to make sure we got everything. Your boss asked you to conduct an investigation a little bit hidden, like you said, secret. Now, why did such an investigation need to be hidden?
Because he know he cannot get official information from the China government. That means, as a smart way, government doesn't want you to know that. But he has to write some report, at least to Hong Kong government, and also as WHO consultant, he want to know more about this. So that's why he asked me to do the investigation in secret in case this gives us trouble. We cannot be publicly do that.
Interesting. Okay, so tell me a little bit about how this played out. So, and maybe the timeline, right? When are you first becoming aware of this virus, of this unknown virus? When are you becoming aware that it has lethality, that it's human-to-human transmissible? Tell me a little bit about that.
Okay, actually this is a long story, but briefly,
yes.
Back to end of December, 31 December last year, when I was assigned for this task, and the first time I know that after the contact and the discussion with very professional people back to China, and I got the first-hand information that at that time, Wuhan already had over 40 cases confirmed, not as they said 27, and also in Wuhan, they already had the genome sequence of the virus, not as they claimed until mid-January. And the other thing is very important thing is there is human-to-human transmission, right, because they are family cluster. And this is based on the public health knowledge. You can quickly do the judgment. But China government doesn't want people to talk about it and also release this information. All the things are held into the top government in China. And they are the one who gave the statement. Everything has to be discussed based on their statement, even if you're a doctor or you are the professors. And also they want people to believe that this virus comes from Wuhan Huanan seafood market. Although we say at least 1/3 people, they don't have that history. But without this history, you cannot get diagnosed.
So you're describing the sort of the inconsistencies you found talking to the different people in your network, that the inconsistencies compared to the official party line, so to speak. Exactly.
And I reported immediately back to Professor Liu Peng, and he wanted me to keep silence. And later, actually, he himself also contacted one of those professional persons and to get more information. And I can quote his word as, now you don't need to do this, and that was 3rd January. He said, I can directly contact them and I have to protect them. Protect means they know this is illegal according to Chinese invisible security state law, So until mid-January, 16 January, I was again assigned for this task for almost 2 weeks. Actually, Liu Peng, he has his own way to know what happened in China, and I was put aside. So I tried to get information by myself, but also at that time, since you may know Dr. Li Wenliang get punished, so those doctors had to shut up for these things. Actually, no more news come out and no more information, and I thought WHO may already get involved to this until the next time I get into investigation.
Okay, wow, there's a lot going on in what you just told me. Let's see if I've got it right. When did your boss take you off the case?
3rd January.
Okay.
But then later, 16th January, again, he bring me to his office and told me that I want you to do more investigation about this. Mm-hmm. And be careful. If not, you will be disappeared.
That's what he said?
Yeah, exactly what he said. Don't cross the red line.
So what would the red line be?
Oh, as I mentioned, in war room, actually, red line is the thing in your mind. You were trained by the CCP government, so you understand some things they don't like. That means cross the red line. So you cannot say the red line. You have to make judgment by yourself. That means in case you cross it by accident, you have to face to the risk. So the safest thing is you get far away from it. So that's why people keep silence, face to these things.
So are you saying that he was telling you to investigate but not seriously?
No, I think let me explain it. So for our Chinese culture under CCP rule, we understand that is something he as the WHO consultant want me to do. And when I do the investigation, I have to be careful because there are a lot of invisible lines there, and I have to make my judgment to say whether government likes this or not. If I heard they said, oh, this is our government don't want us to talk about, then I should stop there and turn back to tell him, yeah, this is a line, and that side there is another line.
I see.
He will build his theory based on these lines in a limited range.
Oh, fascinating. That's a very complicated way to do research.
You have to get at least 30 years training like me back to mainland China to understand this.
Okay. At what point did you become convinced that there was human-to-human transmission?
Early January, as I said. Mm-hmm. So from 31 December, I know Wuhan already knows that. And also our government tried to deliver this sample to Beijing to do further test. I mean, basically that means they can postpone the time to publish the result. And after that, you still cannot publish it. You have to tell the top government, like that makes a statement. So I believe during the whole process, they are sure they are human-to-human transmission. It's not a difficult thing for you to make judgment. So you see the history of the disease. You see people's travel history, see how they may get the contact to the patient and get infected. So these things are the very basic fact you can get when you talk to the patient. And as a public health expert, it's very easy for them to build on the fact that this is human-to-human transmission or this is not human-to-human transmission.
Why do you think they said it wasn't?
Oh, I think they have thousands of ways to explain that, like what they are doing now. For me, I cannot explain their motive, but I can tell you what I see from that time to afterward. Not only about that fact, they actually cover up a lot of things, more than that. So that is just the beginning about their lies. And if you have been staying in Communist Party in China, you will understand that sometimes even a simple thing, they won't tell you truth. I cannot explain because I don't like to lie, but they lies. So that's really something about the motive have to come back to us, that regime, CCP regime. They can answer it very well. They are the expert.
Why do you think the WHO basically followed the regime's position as opposed to doing its own research, or did it do its own research?
You mean whether they have done the research by themselves?
Yes.
I heard that WHO, and I mean, from the internal information, I'm sure there are some WHO consultants like Malik Paris. They have been to Wuhan, and this is not published. But what I also know is China government don't tell people the truth about what really happened in Wuhan. For example, WHO experts go to Wuhan, and they may not get a chance to go to the lab there may be the virus come from, I mean, could to anyone's question, right? And also they are not allowed to get samples from the Wuhan Huanan seafood market. These are done by the local expert organized by CCP government. So based on this, WHO expert can get their own conclusion. But why do they only rely on the evidence CCP government gives them? That's also another question people should ask. What we have to say is WHO behavior in this COVID-19 pandemic include lies and collaborate with CCP government, and also later misleading information like they say it's not pandemic, no point to keep China isolated, I mean, travel ban, right? And also no point to wear masks, and no point to take the hydroxychloroquine and all these things. I mean, WHO have done more than I thought in this crisis. Why do they do that? Why do they help CCP government? It's back to that question, only they can answer the motive.
Very, very interesting. So wait, so you would tell me your perspective on hydroxychloroquine.
Okay, so first, this is not a magic drug. There is no magic drug in the world. But we have to think about whether use this drug or not based on the reality. So practically, as a doctor, if you want to suggest your patients to use something, you have to consider whether it's safe and whether you have alternative choice. And if there is some side effect compared to the good effect, which one is better? So hydroxychloroquine actually is a long-term use drug for over 60 years, initially to be anti-malaria as both prevention and also treatment. And for the long-term study, it's already shown that it's safe for even pregnant lady and kid for long-term applications. Of course, you need to do some half-year check for the retina, but that is not a big deal compared to many other drugs. And also, hydroxychloroquine can be used to anti-SARS. This is even Dr. Fauci show. He has done some research about that back to 2005, I remember. And another thing is, if you focus on the mechanism, SARS-CoV-2 and SARS, I mean, basically SARS-CoV-2 is enhanced version of SARS. Their core mechanism to target people is a cytokine storm. I have to mention you, this is discovered by Professor Malik Peiris.
Oh.
Yeah, the first time. And this one means you have the overreaction of your immunity in your body. So your immune system become messed up, start to attack as a good side or bad side. And this one can overcome it. So this drug has been used in autoimmune disease for long term. So based on the three facts I have confirmed, verified, I think at this moment, faced to the high mutant virus as SARS-CoV-2, and when we don't have the very effective vaccine, it takes time to do the study. So people has to get a good prevention for this high contagious virus. Then this drug can be applied to help you to get prevention and also help you to get treatment when you have this problem. Of course, we expect for the universal vaccine, the efficient vaccine, or even better drug to overcome this. But at this moment, also you can compare the doctors' clinical data. You will see the doctors' data who support the hydroxychloroquine, the quality is much better than those against the hydroxychloroquine ones. You will see the result by yourself.
Okay. I want to talk a little bit about the statistics coming out of China and get your opinion, because in the US, you have a lot of media will take the official statistics on COVID-19 or CCP virus, as we call it, at the Epoch Times and some others we know. They will report those statistics as if they were fact. So, we have all these countries. China actually hasn't had such a big problem with coronavirus, according to the official statistics. The US is way ahead, both in deaths and cases and everything else. What's your opinion on this?
You mean the statistics of the death toll and also the confirmed case from China?
Correct.
Okay, what I can tell you is even maybe the Chinese government doesn't know how many people get infected and also dead, because there are many methods I have been heard and I know confirmed from China during COVID-19. So as I mentioned, they can postpone the diagnosis, and also they can just refuse to give you enough test kit to do the final diagnosis. And also, so I think maybe US people doesn't know it very well, that also in US and other countries, you can use the diagnostic method to at least 90 to 95% accuracy. But back to mainland China, although my lab already, the first time, at the very early time, developed the quick diagnostic kit and recommended by WHO to many countries. But in mainland China, they don't apply that. They just use their own one, and their own ones in many versions only have 20 to 30% accuracy, which doesn't mean 30% accuracy, you did 3 times test, you can get a good result. No, that means at least you have to do like 9 times or even 11 times, you get a real result. But remember, back to China, 2 times is the result confirmed. So you can imagine how many cases are ignored in such situation. And one more thing is maybe can make you understand it better. We even didn't have deaf people in Tiananmen event back to 1989, according to our government.
Oh, I see. So, well, the big question is there, in your opinion, a political will to underreport, right? That's the allegation. That's what the data that we've seen suggests, like the grossly underreporting. But that's why I want to get your perspective on that.
Based on the diagnostic cases, what I know is definitely the real death rate is higher, much higher than what they reported, because as what we have studied in even influenza study, I mean, with Chinese government use another way to judge the death cases. It's not like in US and other country, you get infected, you go to hospital, and then somehow you passed away due to even complications or other things induced, other problems induced by this infection. Then you are counted as a death case of COVID-19. Now in China, it's like this, what I know, they even can give these people some ventilation and other life support until they get twice test for negative of your result in mouse, I mean, using the swab sample. And then after that, they can remove the ventilation and say, oh, he died, but he's not died of COVID-19.
Do doctors in China know that there's been a kind of cover-up and the reporting is inconclusive around the coronavirus?
Not only doctors, even the common people know, especially back to the early beginning. They know that they're unfair. Especially before I review it through this media, the YouTube media, and our government has to change their statement to human transmission exists and claim there are more cases happen outside Wuhan. Before that, our government leaves those patients without result in the common ward in hospital, and doctors, patients' relatives has no any protection, and they are all unfair, and also government don't allow them to talk about it. And also later, when there are other measurements, like you cannot publish paper without censorship, the articles, and you cannot do some kind of treatment, you have to follow up the guidance, like using some kind of Chinese medicine they recommended. So these are all the things they know, but I have to say that not because they don't want to tell truth. I mean, there are some doctors and group of people, professional people, they really want to tell it. But consider the situation back to China, like you see the Hong Kong, the state security law, this kind of pressure, they have no way to tell it. And if they tell it, they have to face to huge loss in their life. You cannot expect everyone try to do such things that take a lot of courage. So they know it, and many people, more people as you thought, know it, but they cannot even talk it in public.
Well, okay, so tell me, why did you decide to go public with this, knowing the risk?
Okay, because I have been sent twice for this investigation, and back to mid-January when I did the second investigation, I realized the real situation is worse than I thought, and no action from WHO to CCP government to overcome this. So at that time, 17 January, when I see these things, I decide to tell it through my own way. I had to find a way to tell the world, I mean, at least to let our government understand there's huge pressure from outside. You have to do some action. I mean, not suspend the research from overseas expert. Instead, you should let people go to Wuhan to know what happened, because that is a Chinese New Year time and huge millions of people do the transportation through Wuhan. That is big center. So it will make the, outbreak soon. But I know I cannot rely on my supervisor and government. So I think I have to tell it through the only media I trust from Mr. Lu De. And at that time, I know I will face to the life threatened. And as the other Hong Kong protesters or other people who try to tell truth in China, I can be disappeared at any time without even any evidence. But I also cannot face to the fact in the future when I see the outbreak come out, people suffer from this and things still cover up, but I didn't tell the truth at that time. I cannot face to that. I won't forgive myself. And also I realize if at that time I don't tell the truth, that means I lose my capacity to tell the truth in my life. So that's why I decided to deliver the message to Mr. Lu. At least before I get disappeared, I want someone else can deliver the message out.
And that's incredible and you're very courageous.
Thank you.
Briefly, tell me, what happened after this and how it is that you ended up coming to the United States.
Oh, after this, several hours after Lu De's show played on 19 January this year, our government quickly got response because they know someone released the real information. So after 4 hours, the confirmed cases number from 60 jumped to 198 triple times. And also the next day they confirmed that there are other cases happen in Guangzhou, in Shanghai, outside of Wuhan. And then they admit human-to-human transmission exists. Also, Chairman Xi issued the statement, the first statement in 2020 to update the level of SARS-CoV-2 into the similar infectious disease as SARS. And later, 3 days later, Wuhan got locked down. After that, because there are more lies coming out of my expectation, and they didn't do real efficient measurement to control this outbreak, so I become very angry and also disappointed to my government. I already have been to this investigation, so I think I know more than other people. I realized it at the time. I keep working with Mr. Lu De and deliver my message through his platform to tell people, for example, like what happened in the hospital, how the government censored the study about COVID-19, like this. And my government understands that they definitely going back to trace the source for Mr. Lu De. So back in the middle of April, Mr. Lu De told me that I'm in danger. And also at that time, I realized that English-speaking country and Chinese-speaking country are totally isolated. Our message was efficiently delivered to our audience in Chinese. But overseas, when people face to this pandemic, they are misled by WHO and the Chinese government. They don't understand what happened. And I realized I may be the only one who can tell this truth to the world, but I really cannot tell it in Hong Kong. Once I stand out, I will get disappeared. You know nothing. So at that time, Mr. Lu De and the other organization who help the people when they get persecution from China government, they helped me to escape from Hong Kong. And I took the flight just after several hours when I left. The Hong Kong policeman immediately know it. The University of Hong Kong, from the Vice Chancellor Prof. Zhang Xiang, they organized alumni and student staff to search me, to get all my information. And some people from my friend group work with the Hong Kong government or the policemen. They told all my friends, even middle school friends back to China, that I have no privacy. They have to tell the policeman all the details they know about me, especially related to COVID-19 things, because I'm involved into the criminal case, and they have to take responsibility for hiding anything related to me. And for back to my parents, just the same day, when I'm still on the flight, the Hong Kong government informed the National Ministry of State Security in Beijing, and then they sent people to Qingdao, my hometown, to my home and treat my family. My parents or I have to say brainwashed, and they obedient, collaborate with them, thought I'm lying and I did something harm the security of my beloved homeland. And also from the middle of May, even before I come to the public, our government started to spread a lot of rumors to attack me. They gave the fake Facebook account using my profile, and they spread the rumors on Twitter, use cyber military, and also on Reddit, on YouTube, and they ruin my reputation and try to describe me as someone who is poor and do nothing, incapable, and they want to get money and green card from US. And also, although I have a Nature paper as co-first author, they just describe me as a hamster keeper in Hong Kong. Like this. So they try their best to ruin me and ruin my credibility and stop me, keep me silent. And unfortunately, my husband, who I get married for over 7 years, collaborate with them in this case.
Oh gosh, I'm very, very sorry about all this. And sorry for laughing at the hamster keeper. We know you were quite a bit more than a hamster keeper. I know that we just got a message that we have to finish up urgently, but any final words before we do?
I think everyone deserves to know the truth, and everyone get involved, your health, your economic, your life. So we should come back to the one who initiated this outbreak, I mean CCP government, ask them to be accountable.
Thank you very much. Such a pleasure to have you on, and the best of luck.